Hi, Jen.
Hi, Bethany.
And hi to Brea, our very special guest. We are so excited to have you today.
Hello.
Hi,
Brea
Bethany.
is a birth doula, a midwife birth assistant, a mom of two yummy, delicious boys, and a retired podcaster. So my first question to you, Brea, is are we bringing you out of retirement?
You are. I have not done podcasts in a very long time. My husband and I had a podcast back in, oh gosh, was it like 2011? And people would ask us, what's a podcast? And now we were too early. We should have just stuck with it. But now he still does all his podcasts.
Can
But
always go back.
yeah,
Today is your moment to teach us and for us to learn from you because you are such an incredible person in the birth space with all of your knowledge and your experience. So we just want to get right into it with you. So first, if you could just explain exactly what a birth doula's role is for the patient and the support person.
yeah. A birth doula is a trained professional that helps parents and families throughout pregnancy, birth, and post. And that looks like emotional support, informational support, bringing evidence based information to parents so they can make informed decisions, labor support, and postpartum support to help achieve the desired birth outcomes.
It's amazing. And I think so many, and I'm sure you get this question too, like, why is this role so beneficial? Whether you're in a hospital setting or in a home birth setting, it's essential for a woman to feel supported in so many different ways.
It is. And I came to this work through my own experiences and feeling just a little bit betrayed on what society and culture taught me about birth.
Yeah.
And I feel very passionate about birth education. And that's how I stepped into this role. And having a doula, just the evidence shows that it has better birth outcomes across the board, lower interventions, lower C-section rates, a better experience, better transition into postpartum. And there's doulas for all different areas. There's the birth doula, there's a postpartum doula, there's even death doulas. There's my husband always jokes and says there should just be life doulas. I'm like, yeah,
Yeah. I'll take
basically.
one.
Yeah. I think we all need that.
I have a question about that because I was wondering about the postpartum. Are they usually separate, or is there usually someone who is specifically for postpartum, or does it depend? You can have
It
someone with you
depends. There's some doulas that will do the birth and postpartum, and those doulas are unicorns, right?
Yeah,
It's because it's amazing
which
to have
worked.
the same doula for with you the whole time. I can't do postpartum currently in my life right now, just having 2 young ones, but a lot of times it's most doulas gear towards one or the other, but there are some
Okay.
doulas that do both.
Yeah, and I think it's interesting because I think a lot of people just feel like, oh, if I know I'm going to have a planned C-section or I'm going to have a repeat C-section, what would be the positivity of having a doula? And they don't stop to think that there is such that a postpartum doula is something that is separate from your birth experience
Yeah,
and can provide the support after the birth is just as important as the support during the actual birth
absolutely.
itself.
Is that something that someone,
Absolutely.
let's say they're having a difficult time with recovery, that they could find someone right away, or do you usually have to find your doula well in advance?
So I will say there is a lack of doulas in that area. They do
Yeah.
book up very quickly in advance, but usually we can find someone, even if it's somebody that's not. Even I would step in, and if I have a client that is really until we can get her the right resources and the right person with her. Sometimes you don't need the like trained postpartum doula. Sometimes you need help in other areas, whether that looks like you need help with meal prep or you need help with your other kids or
Mm.
we try and find the help where we can get it. But if a family does want a postpartum doula, I always do recommend booking it in advance. But a lot of times, parents don't realize that they need it until they
Right.
need it.
Right.
So
Totally.
I try in my prenatal meetings, I always try and go over a postpartum plan because I say it's just as important as your birth plan.
Yeah.
And it really helps sets you up for that first year of motherhood and beyond.
Yeah.
Absolutely.
And
What?
so much of that, sorry, go
No,
ahead.
no, go.
I was going to say, and so much of that, those first couple weeks, we were actually talking about in our last episode, you almost don't know what to ask for because you're so overwhelmed, you're sleep deprived. There's so many things going on that almost setting yourself up ahead of time is more beneficial than being in the moment and panicking. Oh my gosh, I really do need the support like right now.
Yeah, definitely. I mean, it's good to go over what nourishing yourself in postpartum looks like and with the partner as well. So a partner can see how a mom might be struggling or how they might struggle and just that communication and having realistic expectations and adjusting those as you go because
Right.
things go
Change.
differently too.
Can you
So,
talk a little bit how you support the partner or what relationship you have with as far as the partner of the person giving birth?
yeah, I always say I'm never there to replace a partner. I
Yeah.
am there to get a partner involved as much or as little as they want to be. I have some partners that are like, I want to catch the baby and I want to like see everything and tell me everything that's going on. And then I have other partners that I just want to be by the head. And they are sometimes more for the partner than I am the mom. Like a mom in labor is super instinctual and they have wonderful intuitions and they if they're doing their thing off in labor land, like I'm hands off, and I'm telling the partner, she looks a little tense in the shoulders. Why don't you go over and rub her shoulders or grab her some water or trying to get them involved
Kind of
as much as they want to be.
helping them help her, basically,
Yes.
right?
And especially in C-sections, there's a lot of downtime sometimes with the partner
Hmm.
beforehand and just explaining to them what's going to happen and what to expect, how you can support them and getting them a chair in the OR because some of them
Yeah.
shouldn't be standing.
Do we need a husband doula as well to the repertoire of
Yeah,
doulas?
yeah.
So, in your training as a doula, did they talk a lot about C-sections or did they really just focus on natural birth?
So I started my training during COVID in 2021, and it was all online, and which a lot of doula training is still online.
Mhm.
You can take in-person classes, but at that point there wasn't a lot of in-person classes. And they did talk about how to support C-sections and other interventions but I will say it left me feeling like I needed more.
Mhm.
And I'm just a better learner in person. That's what's hard about doula work is you go off on your own as a
Yeah.
doula and a lot of people aren't shadowing doulas to learn.
I
We
was
do in
wondering
the
about
home
that.
birth world a little bit more,
Yeah.
but in the hospital, like you can't. It's hard to do that with the amount of people they let in, and so there's a great hospital in our area that offers OR training to doulas.
That's amazing.
So they'll bring the doulas into the OR, explain everything, show you where everything is, show you where the providers prefer for you to stand, like what's hands off, and that was really helpful for me
Yeah.
as a newer doula, and we're trying to advocate other hospitals in the area to do that.
How did you find
Some
that
hospitals with
training?
mentor doula of mine, she does a mentorship doula program for doulas in the area, and I've been just mentoring her for a long time. She does a lot of doula meetups, and there's a really great community of doulas in this area, and I don't know what I would do without those meetups because you need support to be able to process some of the births, just like the
Totally.
parents need
Absolutely.
support.
Yep.
Yeah.
And so we do like monthly, even weekly meetups, weekly media meetups sometimes. And the doula that started that works closely with the director at this hospital, who is wonderful. She's always organizing meetings with doulas and the providers and talking about how we can all work together and what's
Yeah.
working and what's not
So nice.
working. And there's other hospitals in the area too that have those meetings, but sometimes those meetings are to tell us doulas, like, this is how we do things at the
Stay out of
hospital.
this.
And we're like,
Yeah.
no, that's not how this meeting's going to go.
Right.
Like,
Yeah.
It's a totally
we
different
want
approach,
to,
right?
yeah, we want to unify,
Yeah.
but also we don't work for you either. So,
Yes. At the end of the day, you're trying to do something to better the experience for the patient.
mhm,
So it's not really just
yeah,
about the doula. It's not just about the medical team. It's the end result to support this mom in the best way possible and to reduce any type of unnecessary trauma by feeling
yeah,
supported in all the ways.
And I think the hospital
absolutely.
has to believe and understand the
Um,
benefit of having a doula and how it can really, we've talked about this
Mhm.
before, about how it can benefit everybody,
Yeah.
especially when the doctors or nurses aren't able to provide that support, that everyone should be thankful that there's somebody there
Yeah.
that can do that
And
for
every
the
care
patient.
provider
Yeah.
and every care provider is just so different. There's one big hospital system in the Cleveland area that I won't say,
I wonder.
but sometimes we're allowed sometimes we're allowed in the OR and sometimes we're not, which is really hard because you don't know what to expect when you're going in there, and it creates
Yeah.
like hostility right away.
Of course.
And it puts the mom and or the parents or the birther in a defense mode right away because they're like,
Mhm.
no, I want my doula in there. And then also it makes me a little defensive because I'm like, I was just in the OR last week.
And
What's
Right.
different
how
about this week?
frustrating. Yes.
Yeah.
And
Yeah.
you can't even
so
counsel
we're
the mom on what's going to happen or what wouldn't happen because you don't know. You have to just wait and
right.
see.
Yeah. So we're just
So
having even if the policy that they land on is doulas aren't allowed in the OR, at least we would know what to expect and how to
Yeah.
prepare our clients, which I do either way.
Yeah.
But having an inconsistent policy is really tough
That's
sometimes.
That's really tough. I was
And
that-
then the doctor will say it's up to the anesthesiologist, and the anesthesiologist will say it's up to the doctor. I don't have a problem.
yeah,
And it's
pass the
just-
blame.
Yeah.
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 It's such an important concept. And I've worked at different hospitals that, for example, I've worked at ones that was a no, that would never happen. And then
Mhm.
the hospital I work at now, they actually have a doula program where the patients don't necessarily work with the doulas beforehand, but if they come in labor or for a C-section or anything or need one, they can actually, there's on-call people who will come in and support them as a doula. So we
Mhm.
definitely allow the doulas always to come in. So it's so interesting how, you think that, I don't know, there's this idea that I saw, oh, this could never happen. It's an extra person in the room. We don't want more people in the room. And it's fine, especially the doulas that work at where I work now. They do have such an understanding of how it works. And if anything, they're always like, am I in your way? Am I in your way? I'm like, no, it's totally fine. You're
Yeah.
good. And that support that they can provide when I'm turning around and not looking, it's just like another person on the patient
Yeah.
who's watching them, and we can all work together.
Absolutely.
It's amazing.
And it's hard
Yeah.
to sorry, go ahead.
I was just saying, just that extra support. And depending on the provider and where I'm at, but there's times where I can help the mom do skin to skin
Yeah.
right away or cheek to cheek.
Yeah.
And the providers trust us to do that.
Right.
And they can focus on the things that they need to focus on.
Exactly.
So,
Because otherwise I am the one helping with that
Yeah.
and
Mhm.
making sure it's like I share the responsibility with the nurse, but we're both like, okay, if I have to go and turn around, someone has to always be in charge of that. And it can't be really the partner. It has to be
Yeah.
somebody who has a sense for, especially if the partner's nervous or this or that, there has to
Yeah.
be somebody who's assigned to supporting that skin to skin or holding the baby, even breastfeeding the OR, whatever it is. And it just completely takes that off my plate if there's a doula in the room. So
Yeah.
why wouldn't I want that? I don't
Right.
know.
Well, and that's
Yeah.
what I was going to say too. I feel like it's important for the mom, but it's just as important for the partner because a lot of times the partner doesn't know how they're going to react in this situation. And if
Yeah.
something
Oh,
starts
yeah.
shifting with mom, they feel this torn of, am I supporting my partner in this moment? Am I supposed to be with the baby in this moment?
Mhm.
And it
Mhm.
it breaks down this flow of trying to help this be a positive, calm environment and everybody having their wishes being met.
Yeah. And then it's also great to have a doula there because if baby does need to go to NICU, dad can go with the baby and the doula can
Yes.
stay with.
Such
the
a good
mom.
point.
Really,
Yes.
really good point.
Mhm.
Yeah. And
That's-
especially in that moment, then you're that mom's advocate and you're calming her everybody knows what that feeling is like. If you can't have your baby with you, of course, your
Mhm.
your mind just starts racing and you want as much information as possible. And
Sure.
what a gift that is for you to be that person in the OR. I
Yeah.
have a question. So if they don't allow you in the OR and your patient goes in, when do they allow you to meet back up with the patient and start providing that postpartum support?
It depends, but usually right in recovery. I can go back to the recovery room.
And you
So-
and partner, and are they like
Yeah.
counting numbers? Are you
Are they what?
like counting how many people are in the room? Like sometimes there's a stricter like only 2 people or only 1 person.
So usually the doula does not count
Okay.
as your 2 people.
Mm.
You get 2 support people and then the doula.
Right.
Yeah.
That's what I've seen too, that it's
And if I'm not allowed,
Yeah.
a lot of my work, especially if it's a planned C-section, is it comes in beforehand. And that's just going over the surgical procedure and make sure they know they're informed. Like, knowledge in birth is just power, no matter
Totally.
how you're giving birth. And just giving them all the information so they can make empowering choices and so that they know what's going on. I've had instances where I had one instance where a mom was like, I wasn't allowed back into the OR, but she was very nervous. And there's a lot of downtime too before.
Yeah.
So, you know, that
this was a plan.
time can create a lot of anxiety. So just having a doula there
Yes.
with you can help with that downtime before.
Yeah.
But they offered her, the nurse said, "Oh, do you want something for your nerves to calm you down?" And she was like, "Yes, of course."
Right.
It totally knocked her out. She doesn't
But
remember
let's talk about that.
anything.
Exactly.
Yeah.
Yeah, that is such an important point because yeah, of course you don't want to be nervous, but
Right.
talk me through what that's going to do.
Mhm.
And I have how I handle
Yeah.
that is always I would love to make I can give you something, but you may not remember anything. And so let's weigh
Yeah.
it and let's only give it to you if you really are 100% sure and wait it out. And I would say, over 90% of the time, we end up not giving anything because we can work through it and
Mhm.
talk through it.
Yeah.
But
That was a big learning experience for me as a doula early on because I was like, okay, now moving forward, I really need to be going over with my clients what they're being offered and how it's going to affect them.
right.
Because I was when she was in recovery, she's out of it. I'm holding the baby up so that she could nurse.
Yeah.
Right.
And she doesn't remember anything. And I just felt so horrible after that. But that is something that I really go through with my clients
Yeah.
about.
It's really good.
And then we go through grounding meditations and like hypnobirthing tracks they can listen to or breathing techniques that if I'm not in there that the partner can do with them
Yeah.
or having things that they can turn to if I'm not in there. If I'm in there, then I can help lead the way on that stuff.
Yeah.
Can
we
we-
talk a lot about that. It's like just the little tools actually make the biggest differences. And
Yeah.
they're so teachable. And when they're easy, it gives the partner that kind of, they want to feel a part of this. So it gives them an
Mhm.
opportunity to feel like I helped her get through this moment as well. And that's empowering for
Mhm.
them.
Can we talk a little bit about, let's say you are allowed into the OR and I'm assuming you come in probably after they get their anesthesia, correct?
Mhm.
Yeah, like kind of the
Yeah.
same time as the partner. So I can
Yeah.
tell you what I've seen
Yep.
doulas do, but maybe just so someone, if they're thinking about this, what kind of, what you actually do for women as they're laying there, maybe waiting for the baby to be born. And then obviously, I think
Mhm.
we already touched on after baby is born, you can help with the skin to skin or holding the baby and that kind of stuff. But what can you do for the patient? Do you have certain tricks that you pull out of the bag when you're sitting there with the patient? or
Yeah,
talking to
every
them?
client is different.
Yeah.
But I will say, like, the majority of the things that are liked depend, like, some, it's also about creating, like, a very supportive environment and talking to your care providers before that. Some women don't wanna hear anything. They don't wanna hear the
Yes.
side chatter. They don't wanna hear about
Yeah.
what your OB did this weekend but other women actually find it as a great distraction.
Mhm.
Mhm.
But so some people like to be super locked in
Mhm.
on where they're at. Other people just like to be distracted. Other people like to like laugh with their partner or tell a joke or they want to know exactly what's happening so
Yeah.
I can look over the curtain and tell them what's going on. The smell in the OR,
Yeah.
like that burnt
Yeah.
smell. Yes. So like sometimes just taking out some of those like essential oil pads or putting a little drops on their gown. That's a good thing for the partner to do too. Give them the pads to hold in
Yeah.
front of
Yeah.
that. And others put their headphones in and listen to their stuff. Others want me to walk them through breathing and meditations or prayer. I've only been doing this 3 years. I don't have a ton of experience in the OR because I am at home more and
Right.
we just see a lot less of that at home.
Right.
But it's also a lot of low risk pregnancies too.
Right.
But that's probably the most
Well, I've been in the OR a
eh,
lot, and the way you just
mhm,
described it is to a T exactly what I see. There are people who want to close their eyes, just
mhm,
focus, don't they do their own thing in their head, whatever that is, if it's listening to music, just a different kind. Well, there's two different distractions, right? It's like distracting internally, and then a lot of people, we chit chat about random things. Where do your other kids go to school, or just
Yeah.
anything to pretend like they're not where they are in that moment.
Hmm.
And then there's the people who just, like Bethany was, I think, wanting to know, everything that's going on, and that makes
Yeah.
them feel really comfortable. Okay, where are we now in the process? How many more minutes for this and that? And so it's so true. Everyone copes differently, and it's probably nice for you if you've had a relationship with somebody. Maybe they
mhm,
don't exactly know how they're going to want to cope in that moment, but you probably have a
yeah.
better idea than, for example, I do when I just met them 5 minutes before or
Yeah.
whatever.
And it's interesting,
Yeah,
even
usually just going over the procedure with them and talking about what happens, I can gauge, like,
Which type
but
of
you never know.
experience,
Like,
yeah.
some people when yeah, you never know how they're gonna really react,
Yeah.
but I can usually get a good gauge on people
Yeah.
And what's
before
funny is sometimes it
before.
doesn't even like parallel to exactly your personality outside of the OR setting.
Yeah.
I am not a person who needs every detail. I can be a little bit like
No, that's so true.
a fairy and just with
Okay.
things.
Yeah.
But like in that setting, I needed all the instructions. I wanted to understand everything that was going on because it
Mhm.
gave me that sense of control. And
Mhm.
if somebody had asked me ahead of time, I would have been like, I don't think I would need that sense of control. But
Yeah.
how differently it unfolded in that moment. And that's where
Yeah.
the value of a doula. I think a lot of people think if I'm having a planned C-section, and I've asked a lot of people who have had C-sections or repeat one, their first one they tried vaginally, they had the doula, then ended up in the C-section. I said, did you ever consider having a doula for your second birth? They're like, no, because I knew I was having a planned C-section. And I just
Mm.
think what is so important to bring to light is there's so many incredible benefits of having a doula, even if you're having a planned C-section. And I wish I would have
Absolutely.
done that. Like, why didn't I think about having
There's
a doula?
there are just as many benefits because in birth, even when it takes that turn and you have to get the emergency C-section, whether it's an emergency or a
Right.
C-section, it's almost harder sometimes as a doula because some clients, they wanna talk about that in your prenatals, and other clients are like, "No, I don't wanna go there." And
Right,
then I have to respect that, and then if it does head in that direction, usually I have time to do the quick bullet points,
right.
um, but sometimes you don't. Sometimes they're bad, like, they're
Right.
and usually in those cases, I'm not going back to the OR.
But the benefit that you can
Oh,
be for that patient once they get out of the OR is probably even
yep,
more
yeah.
important in a situation like that they then really
Mhm,
need to process the experience
mhm,
that just happened
yeah,
and that you're there and that continuity of care they're feeling.
And maybe in that
yeah,
moment too, if you've already given them some coping, you can tell me, if some I say coping techniques, whether it be meditations or whatever
yeah,
it is, that
absolutely.
you can use those same ones right now when you go back to the OR, and just keep remembering that,
Mhm,
or like whatever I was telling you before, just keep saying that to yourself
yeah,
again, or there's can be some
right,
continuity there, I think.
Self-talk is such a good
right.
thing. We talk about it all the time. It's like,
Yes,
you have to help yourself cope. You have to have your own coping mechanisms
mhm,
for anything in life. But of course, in the birth
yeah,
space, it's vital. Being a parent is super
yeah.
important. I'm always like, I got
A
this.
and, like, a doula is not like a magic fairy that's gonna come bring you the
Right.
magical birth that you want, like, you have to do the work, like,
Yeah.
I will not work with clients that aren't gonna take a childbirth ed class if it's your first birth, like, I can't do my job if you're not informing yourself,
That's a really
so
good point because actually, that's something else that I feel like a lot of people say is, why would I take a birth class if I have a birth doula? It's two separate
Yeah,
Interesting.
pieces of information and
yeah,
support.
yeah, a lot of doulas, like, will have a package where they can
Yeah.
Of
teach private
course.
childbirth ed, but it's just so important, like, knowledge in birth is so powerful. It's how you normalize it. It's how,
Mhm.
you fear it less. The mind-body connection is so powerful,
Yeah.
and the more normalized it is, the more you trust your body,
Mhm.
and the more you're not gonna fight against it something that is not being done to you, like, you are not a victim of birth.
Yes.
This is something that you were created to do. Your body is created to do. And just trusting and letting go.
Yeah.
And that
That's
can be
such
a hard
point.
thing, especially as a first-time mom. Like, you don't know what to expect, the
Yes.
unknown. And even a second, third time.
Yeah.
because they're
'Cause
all
every
different
birth is
too.
so
Yeah.
unique and so
And
individual.
sometimes it's
So
worse
Totally.
because you're like, this didn't happen last time.
Yeah.
yes,
That is a really good
That's-
point.
Yeah. And the
that's
babies are all
hard when
different
I
too.
Yeah.
that's hard when I get like a third or fourth time mom and they're used to having these great quick births and then they have this third baby, wild card baby,
Yeah.
and it's taking longer or it's different and they at some point kind of panic a little bit and like this something's not right. So no, everything is fine. It's
Right.
just different.
Yeah.
It's just
Right.
different.
Yeah. Something I love that you said to us when we talked for the first time is that, and I don't want to say it because I'm going to say it incorrectly, but the more you're in this environment, the more you recognize how much you have to learn from it. But what was it? What was your exact
Oh.
sentence? Because it was so good.
My first year, I really went in. Like how many births did I do? I did over 50 births my first year, which is a lot.
many?
Like even doing
That's
3 births
incredible.
a month. Yeah. Even doing 3 births a month is a lot for some
Yes.
doulas. But I got like after my first year, like just reflecting, I'm like, the more I know about birth or the more I see, the more I feel like the less I know.
Right.
Because there's every
It's-
experience
yeah.
is just so unique and individual. Yeah, the more I
It's a
see, sometimes
constant
I feel
learning
like the less I
experience.
know. And I know a lot. I know I know.
Yeah.
you do.
But
Yeah.
it's just a continuing, you have to constantly be continuing your education. And there are so many great ways to do that. And thankfully I'll take any course you
Yeah.
throw at me. I love it. I'm like a constant
Could
student.
be another certification.
I know.
And then sometimes I'll take a break from the hospital for a little bit and I'll be at home a lot and I'll think, hey, I got to get back in the hospital just to remind myself or see what's going on because the home births are wonderful and it's a holistic environment and low interventions, but
Yeah.
sometimes your work is needed more in the hospital.
Yeah.
And there's just so many scenarios
Yeah.
that
Sure.
come up.
In your home birth experience, when you have to do a transfer to the hospital, are you able to stay with the patient?
Yeah, so it depends on, but usually if the transfer is during labor, which most of the time it's because a mom is tired. It's not usually because of the pain. Mom's tired, mom's exhausted, she's been laboring for a while, or mom, she didn't eat enough, or just
Right.
something, mom needs a break. And if I'm the doula at that birth, I can go with the client. Even if I'm the assistant, sometimes I can still go. And the midwife I work with, she will go too. And she is a wonderful, she's a gem in this community, but she's been such a mentor to me, but she's a really great reputation in the hospital system and knows everybody.
Yeah.
But yeah, and if it's for something after baby's been born, which I would say the most common thing is just there's a little bit
Bleeding.
too much bleeding, that we're not comfortable with, and you want to transfer before that's an emergency situation.
Yeah.
And we can go with that during that type of transfer as well. And then if the care has been taken over before labor by a different provider in a hospital setting, that just looks differently. If they're getting induced for blood pressure or something, sometimes we're there and sometimes we're not. But if the client wants us there and we can be there,
Yeah, as the doula,
We're
I
there.
guess what's the difference? Same
Yeah.
as if you would just go
Yeah.
in.
That's truly the
Yep.
gift of a doula. It's
Mhm.
it's just like it's like bringing your best friend along for this experience that you're like, be with me, don't leave me.
Yes, I know.
I have questions about 2 types of patients' moms, if you have experience with them. One would be, because we talked about let's say you're going to have a planned C-section because I guess you had one before and you're going to have one this time. But what about those moms who don't find out until 36 weeks or something, and maybe you've already been working with them as a doula, that something is going on, that now they need to schedule a C-section.
Mm-hmm.
Are you able to support them through that in some certain
Absolutely.
way? Yeah.
Yeah, I would say the most common thing, but it's not that common, it would be like breech.
Mhm.
And we at home will deliver breech, even though half the time they end up turning in labor. But at home we will deliver breech. So I've had clients switch to a home birth because they don't want a C-section.
Yeah.
Or I've had clients, we schedule the C-section. We've tried ECV, everything before. And sometimes there's a reason why that baby just doesn't want to move.
Right.
And
No, go ahead. I like placenta previa for this
yes.
question. This is
Yeah.
my favorite one.
Yeah.
I feel like
Yeah.
it's like it's not much to argue about. And I had a good friend too who had 2 vaginal deliveries, and then she had complete previa with her third, and so it was her
Mhm.
first, and it's such a different experience for her. Just even that unknown, especially if you've had maybe vaginal different types of
Yeah.
experiences before, and coming to terms with a totally different experience that
Yeah.
it's not an emergency, but you have
Right.
time to process it, but still you have to process it and make
Absolutely.
new
Yeah.
plans. And then the other question, if you work with patients who are VBACs,
Mhm.
then what you do
A lot of
to
home
support
births or
them.
VBACs.
Yeah.
And I've had VBACs in the hospital too. And the biggest thing with that is your care provider. And it's hard because at the hospital, you don't know who's going to be on call.
True.
So my VBAC clients, are you guys familiar with ICANN?
Yes.
Yes.
I can't.
It's a VBAC support group. They meet up all over the,
Can you spell
all
it?
over the,
It's like ICA. It has an H in there, right?
Huh.
Or 2 N's or something.
I think it's just ICAN.
Oh, is that it? Okay. Maybe I think
I
it's something
can-
else. Okay, but anyway, you could probably
I'm trying to remember what it stands for.
VBAC.
So there's wonderful groups that meet monthly. There's one in Cleveland. There's one in Akron by me that's led by doulas, and a lot of moms that have had VBACs or have had C-sections and want to process it go to those meetings, and they talk about which care providers are being supportive and which ones are giving you the bait and switch. So I'll go to those meetings with my clients.
Afterwards
we really-
or before?
Before.
Okay.
Yeah.
Before and after. But a lot of times I try and encourage them to go before so that they can see what's really working for a VBAC. And with VBAC clients, your provider and where you're giving birth is just so
It is.
important.
It's
So
Yeah.
I know home birth isn't for everybody, but statistically, you're going to have the most success at home with VBACs. That not being, you can do it in the hospital, but what that would look like for a client with me is laboring at home as long as possible. VBACs are long. They're essentially like a first-time mom.
Yeah.
And in a lot of the hospitals, the VBACs are unsuccessful because failure to progress.
Right.
And that's just, there's no failure to progress. Truly.
Yeah, that's a big thing. We talk about the percentage of C-sections, the reasons for C-sections, and that's like the number one is failure to progress.
Jen
Yeah.
loves
I
statistics. She always gives
Sorry.
statistics out
I
there.
think they're
and
so
I'm like,
fascinating.
Yeah.
just keep teaching.
Well, like,
Just
okay,
keep
so I
letting me know.
had a breech baby, which I had a C-section, and the fact
Mhm.
that it was 3% just blew my mind. But then I
Yeah,
had a
I know.
VBAC, and I do say, I think it was my nurses, and I had a relationship with them because I worked at the hospital with them.
Yeah.
And I credit my nurses. Like they were
Yeah.
they're like, we're gonna tell her, like, wait a little longer, wait a
Yeah.
little longer, this,
Good.
that. And of course, even me knowing how to interact with my provider and knowing my OB. And I felt like she supported what I wanted, but I don't think she like cared that much, like which
Right.
way it ended up. Like she's
Your
very,
nurses
like,
make a big
yeah,
difference.
but nurses were like,
There's
we're
been
gonna do
time- I mean,
this.
Yeah.
Yeah. Oh gosh, I've worked with so many incredible nurses. And then I've also worked with some nurses that we've had to ask to switch. Like we just weren't vibing with it. And knowing that you can ask
So you can
to do
right?
that.
I love that you're bringing that up because it is
Yeah.
all about you should be advocating for yourself throughout the entire process.
Mm-hmm.
Your wishes aren't being met. If someone doesn't feel in alignment with you,
Yeah.
you have that voice and you have to use it.
Yeah.
And it's also important because no matter what happens, how we're treated and how everyone explains things to you is so important to how we end up feeling about the birth. So like, you
Absolutely.
could have the same exact experience and one person can feel so traumatized and someone else may not.
Oh, yeah.
Just based on who
Yeah.
you're with, which is why
Yeah.
having at least one person that's
Right.
really there for you.
Yeah. I always say to my clients, are you coping
Mhm.
or are you suffering? Because if you're suffering, I don't want you to be traumatized because your birth preferences have
Yeah.
changed. There's no reason. Let's use some of these tools to our advantage.
Yeah.
You're tired, you're suffering. You might need an epidural. Let's talk about what that looks like now at this point that things are changing.
Yeah.
I felt for me, and I don't ever want to compare my birth experience to somebody else, but in my first birth, I was suffering. I was not coping. And I wish I would use some of those tools to my
Yeah.
advantage because I was never giving birth again after that.
But you did. But
But
it's
I
how we
did.
use our
Help her.
experiences,
Yes.
yes, to like to make us better and to be able to have a platform to say, I wish I would have known this, or I wish I would have had
Mhm.
these tools. And we're
Mhm.
help each other through this.
Yeah.
Yeah.
And you can listen to yourself and know, in maybe I had this plan before, but in this moment, I know this is the right choice for me. I know this is what
Yeah.
I need right now. And it's
Right.
not about outside influences. It's you're making that decision for yourself, and it's okay.
Yeah.
All
Yes.
these things are
Yes.
okay.
Yes. A doula's job is to meet someone where they're at.
Yeah.
But you can't want it more than they want it.
Of course.
Yeah.
Yeah. And that's why I always say it's like having birth goals versus a
Mhm.
birth plan and like shifting that mindset
Yeah.
because it's so hard when all of us have a plan in life. We want things to unfold in a certain way. And then
Mhm.
when things change, it is frustrating and you can get down on yourself. And that's one
Yes.
thing in birth. You have to still be your own cheerleader through it all as well. Everybody
Mhm.
else can be cheering for you, but you have to keep that positivity no matter
Yeah.
which direction it's going.
And that can be hard to do when you're tired or you feel defeated, and
Yes.
that's where a doula's job comes in to help facilitate the conversation with the
Mhm.
care provider, because sometimes at that point they don't know what questions to ask. They don't know what alternatives to ask for. I'm not going to speak for my client. Never say never if something was really going on, but I'm going to help facilitate that conversation
Mhm.
with the care provider.
Like, is this what you are trying to say? Or
Mhm.
maybe
Yeah.
would you like an answer to this question? Would that help you understand it
Mhm.
more?
Mhm.
Should
Yeah.
we discuss
Or what
this?
else do you need to know
Right.
to help
Yeah.
make this decision from the
Yes.
doctor while the
Right.
doctor's in the
Because
room,
especially in labor, and you're like you said, you're exhausted. How can anyone think clearly?
Yeah.
And even with going in for a planned C-section or something, with any high anxiety state, you're not going to be able to pull things.
Yeah. Yeah. Mind clarity is like almost like out the window.
Yeah. Yeah.
And
Yep.
then that's when the partners really need support too, because they're like, I don't know what to do either. Then you have two people who are like,
Right. Yeah. Right. Yeah.
I have a question
Cool.
about, so with your work with the hospitals and so there's one hospital that's very supportive, one that can't decide if they want to be supportive or
Mhm.
not. Do you have any thoughts for how either the mom, the patient, if they're in this situation, can advocate to have the doula with them, or just in general, what can we all be doing from a healthcare standpoint or any kind of advocacy to be getting the doulas more involved in the hospital setting and specifically with C-sections?
I think if you're in a position where you are working in the system and you can bring up like, hey, why don't we have an OR training for doulas? Like, why that?
Especially if
Uh,
that's the roadblock, right? If it's, oh,
Right.
well, we don't want the doulas to touch something or be in our way. Okay, how do we fix that?
yeah.
Exactly. It
Yes.
seems so simple, but people don't
Yeah.
think, let's start a program where we're actually bringing people, and then everyone can feel comfortable that.
Yeah. And even just having a lot of the hospitals around here will have, a few meetings a year of meet and greets with the OBs and the doulas for an open conversation. And sometimes those can be really productive.
Yeah.
Sometimes not, but let's have them and see what happens.
Have them
And
than not at all.
Yeah.
Because at least we're
yeah,
moving forward.
I was at one and I said they were asking how they could improve. And I had said, this hospital over here is doing OR trainings. Like, I just did an OR training with them.
Yeah.
Yeah.
And the director was like, what?
Yeah,
Like,
people are
they're
mind
doing
blown.
what?
It takes you have to, and that's such a good point too, because so many things with me. Once I realized, wait, there's this hospital that does skin to skin for every single patient, like pretty much every single patient, and I've been taught that we can't do that. And it's, wait a minute, if someone else can and is doing something, it might take you a minute
Yeah.
to process that, but then that's the first step in,
Yeah.
okay, maybe we can and should be doing this
Right.
if someone else is.
Yeah.
And I think for parents, just communicating with your provider from the beginning. If there is something planned, what does this look like? And who, if they tell me, if you're saying that my doula is allowed and then they tell me that they're not, who can I call in that moment? Or because I've had cases like that where we've had to call the director to get me back, or
Yeah.
and it sucks because I don't want a mom
To have
feeling
to
like they
do-
have to advocate right off the bat,
Yeah.
because it puts them in that defense mode from the
Yeah.
very
Yeah.
beginning.
I know what you mean by that. But
So
yeah.
it makes it tough, and
Yeah.
that's why hospital policy should be clear, and they're not with everybody. Some people have their own, some providers have their own policies than others, but that's why those ICANN meetings are really great to go to, because you
Yeah.
hear, I have a list of names in my phone of which providers I know are going to be more supportive of this and which ones aren't.
Yeah.
And I'm honest with my clients about it.
Yeah. Can I just
I
pause for a
share
second
other
and tell you
experience.
how amazing you are, Bree, for doing that? It's really incredible the way that you are supporting women like that. The fact you're putting a list together just shows how passionate you are and how much you want to. There can be a change, and you're working towards that change. And it takes
Yeah.
people like you to make the changes.
And it is sad because we talk about how you can advocate. And one of the things I would say too, tell your OB all the time, I want my doula with me, like at
Yeah.
every appointment. When you get to the hospital, the first nurse that you see, by the way, I have a doula. I want my doula with me. I mean, but it is sad that we have to do that. But I think
I
that's
know.
the step. That's the next step,
Yeah.
right?
Yeah.
It's one day we won't have to, but in the
Totally.
meantime,
The
this is
more
what we have
people
to
that
do.
are asking for
Then
this,
Yes.
right.
the more we're going to see
If they
change.
hear it all the
Totally.
time, I
Mhm.
want the skin to skin. I want the doula. I want this
Yeah.
or that. Then it
Oh,
won't
the
just be
skin to
this
skin thing too,
one-off thing.
like
Yeah.
that. I had, gosh, yeah.
That'll be
I have-
such a change.
Because we know as
yeah.
mothers how important that first contact with our baby
Mhm.
is. And
Yeah, and when the baby's not doing as well as they'd like, that we're separating the baby and the mom, and then
Right.
that's when we see the baby just decline. Like
yeah.
Yeah.
separating the baby and the mom right after birth is
It's
That's
the
like
most
hard.
unnatural thing, actually.
Yeah.
Yeah.
And that's the thing that I have just in my like 10 years or so. I've seen where it's like taking the baby immediately to the warmer, at least shortening that time. Now skin to skin. And if you think about a lot of the things that we talk about with C-sections, like breastfeeding difficulties, bonding, all this stuff, I wonder how that would change if we can start bringing some of that in to the OR because, the C-sections aren't going to go away completely.
Right.
That's just,
Yeah.
that's what
No.
it is, right? So
Right.
Yeah.
let's make it better for those people.
Absolutely.
Totally.
Thank God we have them for when they're medically needed.
For sure.
Running short on time.
We're getting to the end of our time, even though we.
I saw your list of what you wanted to talk about, and I'm like, are we creating a whole season here? What's happening?
Like the second I saw Jen, I was like, so Brea was like, this is like 10 hours of conversation.
Yeah.
I'm like, I know. And then put 3 birth obsessed people in a room together. You might need to double that. We
And
might be at 20 hours
This
of
is
content.
what we
here.
always do. We always just have this one little thing we're talking
Yeah.
about. And then 1 hour later, we're like, okay, I guess we should stop.
Yes.
But
I love talking birth. I'll talk birth with you guys anytime.
We love-
My end goal is birth education, but I just feel like if I'm really going to do this the way I wanted to do it, I got to put in my dues as
Yeah.
a birth doula, as a midwife's assistant in the hospital system. Like I want to give it my
keep
all. with
learning
the-
because every
It's amazing,
experience,
Brea.
every birth, every hospital meeting, when you see what people say, that's all giving
Mhm.
you so much information. It's amazing. Thank you for what you're doing.
Yes. Thank you so much.
Thank you guys for what you're doing. Mhm.
So I always like to wrap up our sessions with a little special something. And normally it's for Jen, but of course for our guests. Sorry, you don't get one today,
okay.
Jen. This is all about you, Brea. So I have a mantra for you. So I'm
Okay.
asking you to close your eyes.
I
you're
love
gonna-
this.
I know.
You're douling me now.
You're making
She
me really
is my
want
life doula, actually.
You're really making me want to get back into this. I want
Okay.
you to hold your hands in a calm manner, and you're going to repeat after me.
Okay.
My calmness is a gift.
My calmness is a gift.
My commitment to women is a gift.
My commitment to women is a gift.
My ability to encourage is a gift.
My ability to encourage is a gift.
I am truly making a difference.
I am truly making a difference.
I am a gift.
I am a gift.
You truly are a gift, Brea. Thank you for
Oh,
the
I
beautiful
love you
soul that you are.
guys.
We love you. And I think we have to maybe keep this conversation going because
Yes.
I'm not even certain if we got to our second set of
I don't
bullet
even know what we
points.
got through, but it
And
was
I want
great.
to learn more from you guys. I'm going to start listening more to your guys' podcast. But gosh, there's so many questions I have for you. I feel like I
Yes.
need to interview you
Let's
guys
do it.
Yes, let's do that for sure.
as a doula and just
Yeah.
someone interested in birth.
Especially
So-
this one. This one will give you a plethora of facts and statistics.
Oh, I
that
feel it. I
you never
feel
even
it.
know
That's
you
why I'm
needed
like, I
to
need
know.
to interview
Yeah,
you.
she
Yes.
did too.
She has to calm me down sometimes. We don't need our textbook read. It's good.
Love
Yin
that.
and yang. All right. Thank you so much, Bree.
Awesome. Thanks,
All
everyone.
right. Bye-bye.
Bye. Bye.